Let's talk about Memorial and Sheridan. They've been delivering anesthesia services since 1953. We've had a continuous relationship with Sheridan for over 60 years now. Basically, at Memorial, we look at a number of things to measure success. First is safety. Absolutely is first is safety. And we insist on all of our hospital-based contractors, and it's paramount in anesthesia that you're going to have safe anesthesiologists. And we look at, to make sure that we're safe and to provide good quality care, we insist on subspecialization in anesthesia. We insist they bring to us the best qualified, trained anesthesiologists. So safety and quality are paramount, but also service. Service is very important, and we need to give service to our physicians as well as our patients and our patients' families.
So I think if you look at the group from the standpoint of how they conduct themselves and train their physicians and choose their leaders and develop their programs, they have a firm belief in becoming an integral component of the community, of the medical staff, and in caring for patients. Their philosophy really is in lockstep with the healthcare systems in terms of putting patients first and in working closely with families and our staff to really provide a first-class level of treatment for the patients in this healthcare system.
I think the one common denominator for the future with all the healthcare reform and changes coming about is the fact that every organization is looking at how to decrease cost. And that is something that we're looking at as Memorial and as Sheridan, how to decrease cost per case or cost per adjusted admission, however you want to measure it, but we are looking at that and making changes without negatively impacting safety or quality. And that's the most important thing.
We have improved our start times. We've changed our block times for surgeons and our throughput times. Now these are all important because if your case isn't started in time, it backs up the rest of the day. This is very, very important when it comes to your relationship with your surgeons and with your patients, because the patients aren't waiting around. And if I were a CEO looking for anesthesia today, I would definitely select Sheridan Anesthesia Services because they always do what they say they're going to do. Every 2 or 3 years, we do a physician satisfaction survey, and anesthesia always ranks very high. So Sheridan Anesthesia has done very, very well in those surveys.
And indeed, with their commitment, and it was a commitment on their part, as well as Memorial's part, we went forth, and after approximately a year and a half now, I can tell you that Sheridan and Memorial are seeing a lot more patients through the operating room. The growth rate has been exponential because of the efficiencies. We have less cancellations each day because we are more efficient. We have a much greater satisfaction from our surgeons, and with Sheridan and Memorial working together, we implemented a product that is now second to none. Sheridan truly produces what they say they will. They give you people who care, clinically competent, that's a basic, and who administratively know what's good for the hospital, and work together so that each organization succeeds.
Sheridan is a very indicator-driven, metric-driven organization, which is really what Memorial is as well. And we're able to align our goals very effectively. And I believe that that will last a long time into the future.